If you're over age 40 and are experiencing varying degrees of knee pain and stiffness, there's a very good chance that you have early onset osteoarthritis. Osteoarthritis is the gradual deterioration of the cartilage that lines the end bones of your knees. And what happens is you form little tiny cracks, little pits, and as you continue to do the offending motion, those little pits expand and turn into cracks and form more pits. It progresses, and the end stage basically involves having very painful knees, very stiff knees, and this could be like decades down in your life, and eventually requiring knee replacement surgery. Your best strategy if you're at this stage is to prevent those pits from getting worse, from expanding. You should know that cartilage, the tissue itself, is mostly matrix. There's comparatively few percentage of living cells, unlike tissue that forms your skin and organs. And what that means is that the regenerative capacity of your cartilage is not that great, but it still can regenerate if the damage is not that extensive. Here's a model of the knee. This is the patellar ligament. This is the patella or kneecap. This is actually the right knee. You can see the fibula here, distal femur, and this is the distal or the proximal tibia. Now the knee is a hinge joint. It moves like this. Now this is the meniscus. This is called the meniscus here.
This is the posterior cruciate ligament.
And way inside there is the
anterior cruciate ligament.
This is the lateral collateral ligament, or the outside of the knee, and the medial collateral ligament. This is the distal femur head, the condyles that are lined with cartilage. If you palpate around your knee, just know what these structures are. That big bony protuberance to the side of your knee, below your kneecap, that is the proximal head of the fibula, so use that as a landmark. And we know that the meniscus is just about a little less than an inch above it.
Bending your knee 90 degrees exposes much of the anterior portion of the cartilage-lined femoral condyles, while straightening out your knee exposes much of the posterior portion. This is important to know when applying therapy to your knee.
Step 1. Apply 30 minutes of infrared heat to your knee to increase blood circulation. This provides more nutrients and oxygen to cartilage cells. Do once a day. Apply 10 minutes of red light to stimulate cartilage repair in your knee. Do 3 times a day, once in the morning, afternoon, and evening.
Before using the infrared lamp, apply Penetrex natural anti-inflammatory cream all around your bent knee. Rub it in thoroughly into the skin. Lie down in a comfortable position and bend your knees 90 degrees to expose the cartilage lining the front of the femur head. After about 10 minutes, turn over to expose the rear part of your knee.
Bend your knee at a 90-degree angle. Again, you're going to expose parts of that condyle where some of those pits may be forming, and just hit the front of it like that, from the side, the lateral aspect, and the medial aspect. Press into the fat, get that out the way, sweep the area and get all that surface area of your distal femur head. Lie on your stomach, okay, and get somebody to apply the light directly behind your knee. Press down into the tissues as far as it'll go to get the tissue and fat out the way, so you're closest to the bone. What's great about the red light therapy device is that it penetrates fairly deeply. You can see a better view here how this light goes right through my hand. So rest assured that this light is capable of reaching the cartilage deep inside your knee.
Step 2. Apply pulsed EMF to your knee to further enhance cartilage repair. The OMI ring or flex pulse device may be used. Do 30 minutes in the morning and 30 minutes before sleep at a minimum. For best results, use the BioBalancer Tesla Fit Pulsed EMF mat for treating larger areas with higher magnetic field strength.
Pulsed electromagnetic therapy, or PEMF, utilizes a weak magnetic field generated by pulsed electrical current traveling in a wire coil. The properties of this magnetic field affect cellular activity in a way that promotes healing and regeneration of tissues. According to a study published in the Journal of Rheumatology, pulsed EMF has been used for several decades now to improve the outcomes of non-union fractures, joint fusions, and avascular necrosis in hip joints. There are documented cases of beneficial PEMF effects on chondrocyte, fibroblast, and osteocyte metabolism. Medical research continues to find promising results with pulsed EMF, which is why it is one of the few modalities that I use and recommend to people to heal chronic pain. There are several FDA-approved devices on the market. The one I recommend is Oxford Medical's PEMF ring. To use it, simply place your leg into the coil until it circles your knee and turn on the device. The intent is to activate chondrocytes in your knee cartilage to generate more cartilage where it is needed.
You can also use the Flex Pulse portable pulsed EMF device. Despite its smaller size, it puts out a stronger magnetic field than the OMI ring. It's portable, so that gives you a couple of benefits. Number one, it's small enough to carry to work and travel. It's got this nice belt clip. You could clip it onto your belt, apply the electrodes to your knee, and go about your normal duties. It's rechargeable, so one charge lasts about 3 to 4 hours, and it depends on the intensity. You'll need to get a knee brace or an elastic band. You wrap it around your knee. Take the magnetic coils, stick one on either side, and then turn the device on. It has settings for program and intensity. You could choose program 1 or 2 for cellular repair and regeneration. Remember, we're trying to stimulate the chondrocytes. Those are the cells that secrete the cartilage matrix. So you want to set the intensity to 10 and the time to 30 minutes to an hour. Press the button and you're all set to go.
The BioBalance pulsed EMF machine can treat a larger area as it incorporates a mat with multiple coils. This is more convenient for treating both knees simultaneously. The Tesla Fit machine is designed for clinics and offers 8,000 Gauss magnetic field strength for faster results. It is typically used for numerous types of chronic health conditions. Both machines have a higher price tag and should be considered an investment in your health. They come with a complimentary consultation on usage protocols.